Hey there, my name is Andy Hollowell. I'm a licensed clinical therapist, and I hope you find this video helpful.
No one's mental health journey is linear. Coping with depression requires perseverance, consistency, and support. Depression, or major depressive disorder, is a mood disorder characterized by persistent feelings of sadness and hopelessness. It's one of the leading causes of disability worldwide, according to a report from the World Health Organization. While individuals with mild symptoms are sometimes able to heal without formal treatment, anyone experiencing symptoms of depression ought to consider seeking professional help. When depression symptoms interfere with daily life and can't be adequately addressed via outpatient care methods, inpatient treatment may be appropriate. The duration of inpatient depression treatment varies, but is typically somewhere between 3 and 14 days. Today, we'll learn about the factors that can influence your length of stay in an inpatient treatment facility and actions to consider after leaving inpatient treatment for depression. So why should someone seek inpatient treatment for depression? Inpatient treatment refers to mental health care provided in a hospital setting or other treatment facility where individuals with severe mental health disorder symptoms or those who are experiencing a mental health crisis can receive 24/7 monitoring and medical stabilization. Depression is a common mental health disorder that may be treated in an inpatient treatment facility because severe major depressive symptoms can put yourself or others in danger. Inpatient treatment for depression should be considered if you're experiencing suicidal ideation or self-harming, you're unable to take care of yourself due to your depression, or you have unhealthy coping mechanisms like substance abuse. The goal of inpatient treatment for depression is to reduce your symptoms and help you develop the skills you need to manage them going forward. It usually involves a combination of therapy sessions and medication management. So what factors into how long you're in inpatient treatment for depression? The time frame of an inpatient facility stay can differ from person to person. It can last a few days, or your clinicians could believe that it's in your best interest to continue inpatient treatment for several weeks. Factors that can influence the length of your stay in an inpatient depression treatment program include the severity of your symptoms, your goals for treatment, the speed of your progress, and if you have any co-occurring conditions. Typically, inpatient care teams will begin the discharge process once they observe a significant reduction in depression symptoms. So what are the next steps after that? Regardless of the duration of your inpatient treatment for depression, taking the appropriate steps afterward can support your ongoing mental health journey and help you reach your long-term goals. After completing inpatient treatment, your care team may recommend that you step down to what's known as a lower level of care. This allows for a smoother transition back to your daily life while providing the opportunity to hone depression coping skills in a less structured environment. Inpatient treatment is the highest level of care for mental health distress, followed by residential treatment and then day treatment programs. Since many people who are admitted into inpatient treatment have severe depression that they can't manage on their own, or they're in danger of hurting themselves, it's important that ample structure and care is still provided in their next step. Residential treatment refers to a long-term stay in a home-like facility that allows you to develop the skills and coping mechanisms that you need to reduce depression. It provides a safe and judgment-free zone to explore your mental health through therapy sessions and varying dynamics. It can also include movement opportunities like yoga and exercise and different outings. Partial hospitalization programs or day treatment programs involve treatment that offers structured programming for support without overnight supervision. The day treatment programs allow you to receive the treatment you need while gaining independence. It allows you to incorporate your newly learned skills immediately into your day-to-day lifestyle. At Lightfully, we offer both residential and partial hospitalization programs. They both last approximately 30 days. While the residential program provides 24/7 behavioral care, our day treatment programs can range from 5 to 7 days per week of structured schedules. Completing any treatment program for depression represents a huge, brave step on your mental health journey. If you need support with treatment planning after leaving an inpatient program, or you have questions about other levels of care, Lightfully is here for you. The framework of our clinic consists of evidence-based, clearly defined, data-driven, and whole person-centered care. Remember, change is possible. When you're ready to take the first step, reach out to our admissions team. We'll take the next steps together towards the fullest, brightest version of you. you.